Hello, my name is Mariah Peterson. I will be presenting on hypertension, and this is for the nursing class of 737. So an introduction regarding hypertension. It is estimated that there's 119 million adults who have at least stage 1 hypertension according to the CDC. And hypertension costs the United States at least $131 billion each year, which is a significant amount to put on the healthcare system. Only 1 out of every 4 Americans have their hypertension under control, which correlates to only roughly about 27 million out of that 119 million adults who do have hypertension. So it's not very well controlled. High-risk populations include African Americans, Asian, and Hispanic populations. The pathophysiology of hypertension includes basically several systems. So the nervous system, the renin-angiotensin system, and the kidneys. Those are all interrelated. And then basically, if the blood pressure is too high over a long period of time, it can cause damage to the vessels in the heart. Other causes that can be modifiable that relate to the pathophysiology of hypertension include physical inactivity and poor sleep, such as sleep apnea, having a family history of cardiac or high blood pressure, a poor diet with a very high salt intake, so foods that are canned, frozen meals often have a lot of salt, oral contraceptives, and NSAIDs, antidepressants, and corticosteroids can all increase intravascular pressure. So clinical presentation, oftentimes patients will be asymptomatic unless their blood pressure systolically is over 180. In that case, they will present with a headache, shortness of breath, eye pressure, nosebleeds. I've seen some pretty significant pressures where the monitor won't even read, and at that point, most of the time, I've seen bleeding from the eyes and I've seen bleeding from the nose. So when it gets to that point, it's not good, and there's other risk factors such as accelerated hypertension. So clinical definition criteria based off of UpToDate and the American Heart Association. So stage 1 is a systolic of 130 over 80, and stage 2 is a systolic of 140 over 90. However, as the provider, you must check the blood pressure on 2 separate occasions, and if white coat syndrome is involved, then the patient should be instructed on how to take their blood pressure, and they need to take it at home at least 2 different times to see what their pressure is, or if it's dropped when they're at home. So diagnostics, obviously you need to have a blood pressure cuff. Manual is better. Patient should not have had any coffee or cigarettes 30 minutes before taking the blood pressure. Feet must be flat on the floor. Arms should be uncovered. Arms should be supported and at the level of the heart. And then blood pressure should be taken in both arms to compare. And then again, 2 or more elevated blood pressure readings, at separate appointments are needed for diagnosis of either stage 1 or 2. The differential diagnoses for hypertension include secondary hypertension, which is often due to another underlying disease that the patient may have, hyperaldosterone, chronic kidney disease, which can cause increased pressure, and aortic valve disease. So the differential rationale includes secondary hypertension, so again, is blood pressure from another identifiable cause, such as an endocrine disorder. That'd be a good example. Secondary hyperaldosterone, is excessive production of aldosterone, which then causes excess stimulation of the renin-angioaldosterone system, which then leads to the retention of more fluid, which then increases the vascular volume and increases the blood pressure. Chronic kidney disease, so if the kidneys are damaged, they can't filter as well, and there is again a rise in blood pressure due to increased vascular volume. And then aortic valve disease, most commonly aortic stenosis, which then causes an increase in cardiac workload and an increase in the vascular pressure as well. So these are all things to keep in mind when a patient presents with hypertension. So management. So if they're stage 1, then they can attempt for 3 months to do a non-pharmacological treatment plan, which includes exercise, a low sodium diet, and smoking cessation. It's been shown that if a patient exercises, it can reduce blood pressure by 15%. If they are, again, stage 1 and that does not work after 3 months, then they needed to be started on either an ACE inhibitor, a calcium channel blocker, or a thiazide. For stage 2, a patient may need at least 2 of those antihypertensive agents, so an ACE and a calcium channel blocker, an ACE or a thiazide. Usually the ACE and the calcium channel blocker are the first line for stage 2. And then if they are African American descent, then you want to use a thiazide diuretic as the first line treatment for stage 1 or 2. So the implications in clinical guidelines for providers to stay up to date on, the first includes the Joint National Committee, which states that providers should initiate pharmacological interventions for patients with diabetes and chronic kidney disease, with basically starting interventions when at a lower threshold. So they may not be or meet stage 1 or 2 criteria, but they should be started due to the increased risk that these chronic diseases pose to the patient. And then again, those who are African American should be treated with a thiazide or a calcium channel blocker. And chronic kidney disease patients needed to be started on either an ACE or an ARB. And then American College of Cardiology states that a 10-year ASCVD risk needs to be completed, and then again, keeping the blood pressure less than or equal to at least 130/80 is very critical for these patients. So the Christian worldview includes being aware of what this diagnosis means. It can be quite life-changing for patients, and many of them may not want to modify their lifestyle, but they need to be aware of the potential risks, which are significant with this, and it should not be taken lightly. Again, encouraging them in a healthy manner to go ahead and make those lifestyle modifications, and that though they may seem daunting, they can be accomplished. As a provider, having an encouraging and optimistic attitude in a Christ-like way shows his love for others, and we can reflect that. 2 Timothy 1:7 states, "For God gave us a spirit not of fear, but of power and love and self-control." And I think that's a good verse to keep in mind, just that we need to meet patients where they are and see where they're at and show them care and love, and that they can have control over some of these things. And then again, going back to that verse, we as providers need to also model healthy lifestyle choices and self-control to our patients. Thank you very much. These are my slides with references. Second page of slides with references. And this is my one slide presentation that was presented earlier. And that is all. Thank you.